Welcome back to the Woven Well podcast. I'm thrilled to get to share another episode with Laura Ducote, nurse practitioner, wife and mother, and fellow fertility care practitioner at Woven Natural Fertility Care. And we're talking about how to make the most of your Creighton chart in the doctor's office. I invited Laura to join me for this because she has the unique ability and perspective on both sides. So she teaches the Creighton Model System of fertility appreciation with us at Woven Natural Fertility Care, and she's also a NaProTechnology medical consultant who looks at charts and uses them in her practice. So the perfect combination. And I'm excited to chat. Laura, welcome back to the show.
Yeah, thanks, Caitlin. Happy to be here.
We work very closely together, and I think your perspective of seeing both sides and what's valuable is going to be really helpful because I'm thinking about the women out there there are two categories. The women out there who are like, is this really worth it? Like, do I really need to take the time to learn Creighton and to do all of this? And then the other category of women who have Creighton charts and they're like, okay, now what? How am I supposed to use this? And so, how to make the
Mhm.
most of it and in a medical environment, I think can be really beneficial.
Yeah, absolutely. I mean, when I have a patient that comes in with a chart, it streamlines honestly the visit so much for me because there's so many questions that I could ask about, what their period looks like, where they're ovulating in their cycle, how long is their luteal phase. So many different pieces of information that sometimes I feel like I have to pull out of them. Or maybe they've done even like a form, like an intake form for our visit. And so they're like answering all of those questions, possibly. And then I have to go back through and review that. But if they bring in a chart, they literally just open the chart and like within a glance, I can see so many of the answers to the questions I would ask, like right there in seconds. So it's
Yes.
so beneficial. I feel like we're starting to notice that fertility awareness and charting cycles is becoming a little bit more mainstream. We'd love to see
Yeah.
it advance even further.
Yeah.
But I think that this is going to be an area where a lot of women's health professionals are going to have to start recognizing how to utilize this because it's a massive tool.
Yes, I think you make such a good point, and I think about the fact that you went through so much training on the medical side in order to be able to interpret that chart. So
Yeah.
it's not just a general, when does your period start? And do you notice any symptoms in between? I mean, that's a great starting point, but I think that's something that's unique about the Creighton system specifically is that it has been so tested and so defined so that everything that we teach a woman to do, everything that we teach a woman to observe, and the way in which she charts, it gives valuable information, both for themselves and their ability to use it, but also like you're talking about on the medical side. And
Yeah.
it may be helpful for us to just briefly talk about what Creighton is because I think that a lot of people who are looking for an episode like this about Creighton may already know, but just to kind of lay it out there, the Creighton model system is one version of a fertility appreciation method that utilizes the reproductive biomarker of cervical mucus. But it's not just are you having mucus or not. We really teach you to how to understand the specifics of the different types of mucus, what they mean, when they occur, how it could point to all sorts of reproductive health issues that are going on, in addition to when are you fertile or unable to conceive a pregnancy within a cycle. So the unique thing about the Creighton system is not just that it's so detailed, so detailed, but also that there is a partnership with this medical component called NaProTechnology. So, what would you say is unique about NaProTechnology that you would get that would be a little bit different than if you went to just your standard local OBGYN?
Yeah. So there's honestly a good number of things, but I would say, I mean, honestly, just the NAPRO professional having someone that can understand what's happening on that Creighton chart, like when you've gone through, I mean, our ladies have gone through a good amount of information, a good number of sessions with us, they've learned a lot and they know a lot at this point after doing the Creighton Model System. So to have somebody that really understands everything that you already know plus more, I think is super helpful to be able to understand the data that you're bringing in. But then I think specifically to NaPro, the mucus cycle scoring, like how important that mucus cycle quality, quantity, all of that information is super helpful. If you're getting mucus in areas that are, we're thinking are unlikely to be your fertile window, like when we utilize those yellow stamps, that tells us information that somebody that's not trained in NaPro might not necessarily pick up on what that even means, or they would be like, how are you identifying a fertile window if you have mucus every day? They might not even have
Yes.
any understanding of how we do that, and
Yes.
question, well, you can't feel confident in your ovulation time if you have mucus every day. And you and I both know very well that we have spent a lot of time working on them being able to identify that properly. So,
Oh,
I think that just having that baseline understanding is huge. And then
yes.
I think the other part that we do focus on some is them being able to chart the nuances of their period, like if there's some brown or black or any of those sorts of things. They may not have even realized before that they were having blood tinged spotting, or blood
Mm.
tinged mucus, that little bit of spotting mixed in with their mucus, and that could be helpful because that could point us to some further testing that we might want to do. So there's just a lot there.
Yeah, I'm so glad you mentioned how a medical professional who's not trained in the Creighton model system may look at a chart and go, how can you know what's going on? Because I have had numerous clients in the last year or two go to their local doctor and try to show them what they're doing and, like, hey, this is this exciting thing. I'm learning so much information. And they're sort of made to feel like, oh, you can't do this or this doesn't make sense. It's like, well, the reason it doesn't make sense to you is because you haven't been trained in it. not because
Right.
not because the system itself isn't, a gold mine worth of information.
Mhm.
Previously, we had Dr. Naomi Whitaker on the podcast, and she was talking about how when she gets a Creighton chart, she feels like it's gold to her. It just gives so much information. And,
Mhm.
I think about from a practitioner standpoint, when I have a client that goes into work with a medical professional, especially one trained in NaPro, I want them to be able to get the most information possible from a Creighton
Mhm.
chart. Now, I think that what helps you be able to have that really positive encounter and get the most information is to have a chart that is easy to read, well done, that you are a consistent charter, and that you have really good support. So
Mhm.
if you are consistently writing it down every day, but you're never meeting with your practitioner to make sure it's correct, that information is not going to be super helpful. And in fact, I will have NaPro uh, physicians or medical professionals who will say to the patient, why don't you call your practitioner? Because I think that they could probably help you out there. And so
Yeah.
that will get them to call me for the first time in a long time.
Mhm.
And we take a look at it again and really um, give them some more confidence and clarification on areas that maybe over time they forgot, or maybe they stopped coming to the education sessions and they never got the full benefit of the system. On your end, what do you feel like you can really make the most of a chart with? Like, what kind of information is super helpful to you on the medical side of things?
Yeah, so I mean, I honestly think, just to reiterate what you've said, just having, accurate observations, having somebody to help keep you accountable sometimes with staying up on that, routine and actually doing the observation. And then having that chart look accurate, that they're
Yeah.
actually down everything that they're seeing. Sometimes we'll have our ladies that are struggling with infertility. There are kind of those subfertility instructions where they can write down like left, right, or abdominal pain. on there in addition. Sometimes if they're on progesterone, we have like little notes to make of when they're taking those things. I even honestly, I don't know if everyone does this, but I also even have some of my ladies kind of almost make like a little legend down in the bottom.
Always.
You can use a star, you can use an asterisk, something like that, of if there's like, hey, we're really watching how your headaches are changing with this particular treatment plan, or
Yeah.
mood symptoms, or whatever it might be that we're watching for them. um, if I'm seeing that those little asterisks are like, there's a lot of those as we're getting started, to discover what the underlying problems are there. And then as I watch down that chart, I'm seeing less and less of those happening, or I'm seeing, different changes in the length of that post peak phase, or the amount of mucus that's there. We're getting more dryness when it should be dry, or we're getting better mucus quality when there should be better mucus quality. Those are all incredible things for me in terms of like what we're doing in terms of helping this woman's health is clearly making a difference on her chart. So
Yes.
I think just, yeah, as you said, the chart being a true, accurate reflection of what's happening in her body. And then if there's any particular symptoms that she's having that we think could be hormone related, which some people don't even think headaches and hormones, like, some people don't even make that connection, but sometimes as I'm talking with them, we figure that out. um,
Yeah.
but so any sort of little symptoms that we're kind of watching for, we can sometimes make a note of, and all of those things I feel like are super helpful.
Yeah, and I think too, when we talk about the several things you just listed, like knowing the length of your post peak phase and being able to identify your peak day, those kind of things are maybe a little more specific to Creighton. And I think a lot of times people think, oh, well, I'm generally aware of my cervical mucus and I kind of know when I see it or when I don't. But you're actually using that information as a medical professional to determine what labs to draw or
Mm.
determine if you're seeing improvements on the chart and in the health, or
Yeah.
if you need to look into a possible supplement or medication. And so this
Mhm.
information matters. It's not just kind of general, it is very specific. And that's why you want to make sure that you are making full observations. You want to make sure that you know how to chart and you feel confident with that. I know it's a lot, but I never want, especially new users of the system, to feel really overwhelmed with it.
Yeah.
It's okay if you do initially, but that's the whole purpose of us on the practitioner side, is that we want to help you be confident and eventually independent. So I want to hear when you're overwhelmed. I want to hear when you're frustrated. I want to hear when you're confused, because you're not trying to impress me. You're not trying
Yeah.
to show me all the amazing things you the goal is for you to express openly and honestly the areas in which you struggle so that I can meet you there. I can give you examples. We can focus on it a little bit more, and then you leave more confident. Now, one of the things that you were talking about is that you look to see, do the headaches get reduced as you go on? Is the extraneous mucus going away? Like, I think that's such an interesting thing to note for a second, because a lot of women think about charting for 2 or 3 cycles in preparation for their first visit, but they
Hmm.
don't really understand how the chart can be beneficial over time. And so maybe we could just talk about that for a minute, like why you would want to continue charting 3, 6, 12 months into medical treatment. What do you think about that on the medical side?
Yeah. Oh, I could speak to that for longer than we have on this podcast, but I think that probably the biggest thing is that because I also teach on the fertility care practitioner side, I know how much they know, or that I hope that they know when they're coming to see me on the medical end. And so, if they have somebody that's watching these kind of NaPro markers with them, or they've started to learn that because they've been charting for more than a year and they've kind of learned some of those aspects for themselves, then as we're going through treatment, it's one thing of like, okay, within 3 cycles, within 6 cycles, that folliculogenesis phase, that where the follicles are in a certain hormonal environment for 3 months before that is the egg that's recruited for that cycle. So 3 months worth of charting, the fourth cycle might be what we finally see the change really happen from something that we've been doing in their treatment plan. Like sometimes those things can truly take cycles to happen, multiple. The other
Yes.
thing is when we get into long-term time frame is that if we've gotten to a place that we feel really stable with how she's feeling great, the charts are looking great, we're like, hey, I'll see you next year. She knows at some point, hey, something's changing. Like I did something different with my diet. I stopped taking that supplement. I did whatever. And like now it's kind of back a little bit to what it was before. My luteal phase has shortened. My mucus cycle's not right. Whatever it is, she a lot of times knows that. And so that can be a cue for her to be like, hey, I need to come back and see you earlier than a year because something has, we need to regroup a little bit and maybe change the treatment plan up. Or maybe, I mean, I'm guilty of this as a patient myself. Maybe I just need the accountability of staying on the treatment plan.
I love it.
So,
Yeah, you feel empowered and you're actually participating in your health. I had a client that I was speaking to recently who she had been working with a NaPro physician for a while and she was struggling to ovulate and she was on vacation. She was not working directly, like having labs drawn or anything like that, but she saw her mucus window and it was amazing. It looked really good and it was different than she had seen before and they had been trying to conceive. So they made use of that time and they conceived. And she told me, I know. And she told me that it wasn't because of the lab draws. It wasn't because of her meetings with the NaPro doctor. It wasn't, those are all necessary and important to establish her baseline health to help her get to this point. But
mm-hmm.
it was because she knew, even on vacation, outside of her normal routine, that she was seeing really good signs of fertility and they could make an informed decision about that. So it's just a reminder that these Creighton charts can be used in so many different ways. And sometimes they're personal use, sometimes they're for fertility, sometimes they're for women's health, but we always have that medical component as well. So, oh man, thank you so much, Laura, for coming on, talking about that, and giving us your unique perspective of both sides.
Absolutely. Pleasure to be here.
Listeners, today's episode was very specific to Creighton and NaProTechnology. We realize that. And if you're interested in learning more about either, we have a ton of resources available to support you. But we also provide natural fertility education for anyone interested in learning more about their own female design and how to confidently and peacefully participate with that design. So we hope you enjoy our other episodes. And if you do, maybe take a second to leave a review for others. It means a lot to us. As always, thanks for listening as we continue to explore together what it means to be woven well.